morning. My name is Elisa Moya and I am one of the embryologists of the international group of UR. According to the current situation, it is normal to have some questions and doubts about pregnancy and coronavirus. First of all, with the available data during pregnancy, there is no direct mother-to-child transmission of coronavirus through the placenta. The majority of newborns from mothers infected in the third quarter that have been analyzed have tested negative. The few cases of infected babies that are registered have been recorded after the birth. This is because coronavirus is propagated through the droplets from the nose and the mouth that are released when an infected person coughs or exhales. It is important to mention that there is no evidence that suggests a higher risk of miscarriage because of the coronavirus infection. However, there is an increase in the possibility of premature childbirth and further complications in the third quarter. There is currently no evidence showing that pregnant women have a higher risk to present serious symptoms of coronavirus than the rest of the population, or to suffer complications associated with the virus. However, it should be noted that a pregnant woman is at the stage where there are a lot of immunological and physiological changes, which can have the woman more sensitive to this type of viral infection. This is why, from UR, we believe it is very important to follow the measures put in place by the main health authorities. These are very simple practices. For instance, to wash the hands very frequently, to have 1-2 meters distance with other people, and to avoid people with respiratory symptoms. In addition, we have to see the measures recommended by the Spanish Fertility Society that are worth highlighting. It is precisely recommended that the majority of transfers shall be carried out in a deferred manner, by vitrification the embryos or gametes, and by carrying the transfer at a later stage when the pandemic is over. Regarding to the successful pregnancy rate, has been proven that pregnancy rate with vitrificated embryos is very similar to pregnancy with fresh transferred embryos. Vitrification is a standardized process and the survival rate is almost of 100%. That is why there is no risk of vitrifying the embryos in these coming weeks due to the pandemic. With this message, we want to transfer a patient for the patient, and lots of regards from UR.